This free clinic is headed by females. Dr. Diveshni Govender established the facility after her first COVID-19 patient succumbed to the virus in December. She says that was her breaking point.
A lot of the mortality occurred at home, where people were afraid to go to hospital, and that is what spurred me to let's get something going in the community so that they feel comfortable to come to us knowing they're going to get treatment, they're not going to have a big bill at the end of the day, and they don't have to wait in queues, and we will give them some sort of support.
The process to open the clinic at this civic hall began on January 8th with the help of community stakeholders. 72 hours later, the first patient was treated.
When we started the facility, we had no beds. It was more a chair facility. Subsequently, we had on the last minute a donor before the day we opened with 6 beds, and we have now got 15 beds. We can go up to 18 in total. We do have much more IV sets, and when we started, we didn't have much medication to give our patients to go home. So what would happen, I would give them what we had and give them maybe a small prescription to take home if it was medication that I didn't have in my own surgery. But subsequently, donors have come aboard, finances have come aboard, and we've purchased all that medication. So patients are now going home with a full contingency of medication.
Now COVID-19 patients from across Durban come here for treatment throughout the week.
I have my in-laws who are elderly, and she's been treating them. Been actually calling her any part of the night and day, and she's there to help us.
Most of the people also don't have medical aid and don't have that money to go get tested.
People have also volunteered to work at the center.
Dedication from the community. Dedication, definitely. It makes a very big difference if we stand as a community together.
And Govender wants to keep the momentum going.
If each community or each area sets up a clinic like this, it will alleviate the burden on the hospitals, so they have the time to deal with the sickest of the sickest and the true admissions, while we triage the mild, moderate cases through. So it's very important going forward, even not just beyond COVID, so just alleviate that stress on the casualties and the trauma units in both state and private facilities.
The free clinic employs admin staff, 2 nurses and a general cleaner. They are paid with donations from the local community. Since the clinic was established in January, over 100 patients have come here for treatment, and now bookings for a spot here can be made via WhatsApp. For Newzroom Africa on channel 405, I'm Karinda Jagmohan in Chatsworth.